Hi friends, I welcome all of you to yet another episode of my YouTube channel Future Midwife. Today I will discuss about intrauterine fetal death. Intrauterine fetal death refers to the death of the fetus inside the uterus which occurs after 20th weeks of gestation or before the onset of labor. If the death occurs before 20th weeks of gestation, we called it as miscarriage or spontaneous abortion. First of all, I will explain about the classification of intrauterine death. It can be classified into four ways. The first one is early IUD. Second one is late IUD or stillbirth. The third one is fresh stillbirth. And the last one is macerated stillbirth. We will see one by one. The first one is early IUD. Early IUD means death occurs before 28th weeks of gestation. In case of late IUD or stillbirth, the death occurs after 28th weeks of gestation. Whereas in case of fresh stillbirth, here the death occurs as very recently. There is no macerated changes occurs in the fetus. The last one is macerated stillbirth. That means the death occurs days earlier and also the fetus shows some degenerative changes. So these are the four classifications of intrauterine death. Next, we'll discuss about the causes of intrauterine death. Around 25 to 60% of causes are unknown. So we have some other risk factors which include maternal factors, fetal factors, umbilical cord factors and placental factors. So we can see each one of them. So first we'll discuss about the maternal factors. The maternal factor include hypertensive disorders such as preeclampsia and eclampsia. Then diabetes mellitus. Infections such as torch, syphilis and malaria. Autoimmune disorders such as lupus, trauma or accident, severe anemia or malnutrition. These all causes comes under the maternal factors. Next, we will see the fetal factors. The fetal factors include congenital anomalies, chromosomal abnormalities, fetal growth restriction, twin-to-twin transfusion syndrome, cord accidents such as cord prolapse, true knot, knuckle cord, etc. So next we will see the placental factors. The placental factors include placental abruption, placenta previa, placental insufficiency and infarction or thrombosis. Last we'll see the umbilical cord abnormality that are cord torsion, short or long cord and cord entanglement. So these are the causes and risk factors of intrauterine death. Here I will explain about the clinical features of IUD. The clinical features of intrauterine death include absence of fetal movement, absence of fetal heart rate, some mother experience vaginal discharge or bleeding, the uterine size will be less than the gestational age, and some women they experience labor pain spontaneously. So these are the clinical manifestations of IUD. Here we reach the diagnosis aspect of intrauterine death. So we can diagnose the intrauterine death with the help of ultrasound. In the ultrasound we can identify no fetal heart activity, no fetal movement, overlapping of skull bone and collapse of thoracic cavity. Next diagnosis is Doppler study. With the help of Doppler study, we can identify the absence of fetal circulation. And with the help of clinical examination, we can identify there is loss of fetal movement, fundal height discrepancy and fetal heart sound absent on Doppler. So these are the diagnosis measures we can use in case of IUD. Now I will explain about the management of intrauterine death. In the first management is confirm the diagnosis. So we need to confirm the death via ultrasound and also evaluate for maternal complications. So next one is counseling and support. Provide emotional support to the patient and family. Discuss options for delivery and management. Grief counseling or refer to a support group also important. Next, we'll move on to the induction of labor. So we can induce the labor with the help of medication such as misoprostol or oxytocin. Next will be the expectant management. Wait for a spontaneous labor, not prefer in late gestations. The last management is cesarean section. Usually, the cesarean section rarely indicates unless obstetrical complications arise. After the delivery of the baby, it is very important to identify the exact cause of intrauterine death, which can be done with the help of maternal blood test, which include infection screening, blood sugar test, clotting profile, autoimmune screening, etc. So we can go for fetal autopsy. Also, we can go for placental histopathology, genetic test of the fetus. At last, we can go for Clihor Big Tech test in order to detect the feto-maternal hemorrhage. So with these all investigations, we can identify the exact cause of intrauterine death. So this is about intrauterine fetal death. It's a simple topic. In this video, I explain about the definition of intrauterine death, classifications, causes and risk factors, diagnostic evaluation and management. The complication and prevention will be displayed on the slide. Please have a look on it. So in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye bye.